Hello, I'm Elizabeth Vowell. If you watch WAFB TV, you know I'm the evening anchor for 9 News at 6 and 10, but I'm also a new mom, and that is actually the role that we're talking about today. I gave birth to my first child, a little girl, last year, and I have loved every minute of becoming a mom. Well, almost every minute. So if you are a mom, you know the journey is filled with ups and downs and a surprising amount of bodily fluid, especially in those first few weeks and months. But there's also so much about that time when we need the most help and support that moms just don't talk about. I had so many things happen, from the physical recovery to the wild mood swings and everything in between, where I thought, I wish someone had told me about this. So we partnered with Women's Hospital in Baton Rouge to start the conversation about some of those tough topics, some of the really nitty-gritty parts of being a mom. I sat down with a few of their experts to talk about things like postpartum depression, the hard and, let's face it, sometimes weird parts of breastfeeding, learning to love and take care of your body after baby, and even life after pregnancy loss. These talks are based on real-life experiences from me and women I know, but we know every pregnancy and motherhood journey is different. Our hope is that this series just gets moms talking and, more than anything, lets you know you are not alone. Today, in our very first episode of The Journey After Birth, we're talking about something I think is so important: postpartum depression and anxiety. This is something that has a lot of misconceptions, stigmas, and stereotypes, even though it is one of the most common complications for moms. And as someone who spent a lot of time weeping at every little thing after birth, I was so excited to sit down with a super cool and very knowledgeable Dr. Amber Parden. She's a psychiatrist at Women's Hospital specializing in women's mental health, and she's also a mom, so she really knows her stuff. Take a look.
WAFB's The Journey After Birth with Elizabeth Vowell, sponsored by Women's Hospital.
So I'm very excited to talk about this topic today. Dr. Amber Parden, a psychiatrist here with Women's Hospital. So first off, tell me a little bit about your background and your specialty.
Yes. So I am originally from here, went to medical school, went through the whole gambit of what do I do with my life? Did I ruin my life because I didn't like this, I didn't like that, and then got into psychiatry and loved it. Did training and a little bit of practice in New York State, and now I'm back. So we started this practice here at Women's Hospital. It's kind of like a subspecialty practice in perinatal psychiatry, so we see a lot of pregnancy and postpartum, with the idea in mind that I've had child and adolescent training. So in that, I got a lot of exposure in, infant mental health, some of the difficulties that moms have with, those struggles, and really kind of saw the other side of what even the moms were struggling with. And I feel strongly about the idea of, so many infant mental health problems, child mental health problems, kids in general. If mom's not well, kid's not well either. So I love the idea of really kind of maximizing the mom's ability to help take care of these kids. And I make this joke, I'm like, we're, changing the world one mom at a time, because those kids then move on to become the next generation of adults, right?
I love that, changing the world one mom at a time. And that's so true. I mean, your kid does mimic what you do so much.
Absolutely, absolutely. And so the better mom you could be with, all the supports in place and taking care of what mom needs to be that good mom is super important. So it's a lot more work winds up being with the parents than the children when it comes to the idea of child psychiatry. So here, what we've created is, again, this idea of taking care of the moms, making sure that they have their needs met, and when they're experiencing things that they did not anticipate, we kind of really take care of them and treat their issues. And I do a lot of education with moms about how to be the best mom, and as much as we can, because no parent is perfect, right? But
absolutely,
raise well-adjusted kids. So it's important work, and it's a lot of fun. I really enjoy it.
Well, that's great. And you hit on the point that's a great segue of when moms experience things that they don't anticipate. That's kind of what this whole conversation is basing off of things. I wanted to do this because after my pregnancy and in the first couple of months after having a newborn, my first child, my first daughter,
there were so many things that I went, oh my God, I wish somebody had told me this, or somebody had talked to me about this before this happened, because there's so many moments especially in those first weeks and months, that you go, is this normal? Am I crazy? Am I ever going to feel normal again? And it's just kind of part of it. And I feel like education is such an important tool to have, to know kind of what you're going through. So one of those things that I want to talk about was in my notes, I just have it written down as whoa hormones. Because, yes. In television and movies, when they show pregnant women, that's when they show them as weepy and crying and the mood swings all over the place. During my pregnancy, I was pretty steady in that retrospect, but it wasn't until after I gave birth that my hormones went just all over the place, that I was crying at everything, and I just thought, am I just going to cry for the rest of my life? I had no idea the crazy ups and downs and mood swings that you can experience after giving birth.
Oh, absolutely, absolutely. And that's generally what we see a lot of. Anxiety is normal. It exists because it keeps us protected. It exists because if a saber-toothed tiger is coming after us, we have to run, right? So, evolutionarily, we've just turned it into something that looks different. But the thing about anxiety is that anytime there's unpredictability or change, what bigger change can you have than a new human in your life?
Right.
So that shakes things up a bit. And the shift in hormones, it's a little bit more slow and insidious as you're, kind of mounting up the hormones that you need to maintain the pregnancy, and they kind of plummet after delivery. So that looks a lot different. It makes you more vulnerable. So there is this biological response in the body that kind of contributes to this idea of what anxiety or depression or all of this stuff looks like, but it just makes us more vulnerable to that in the postpartum period.
So in addition to the hormones, of course, there is kind of the, I guess, average response of the hormones and the crying. You're going to be emotional. You're going to have mood swings after you give birth, but then that also can lead into postpartum depression and anxiety. So what is the definition of postpartum depression and anxiety? Because I feel like this is a topic that it doesn't get a lot of attention. It's hard to talk about because I think people don't want to be labeled. They don't want to, there's so many stereotypes and so many misconceptions. So let's start with the very basics. What's the definition?
So I'll start with, generally the chief complaint is what we call it of what the mom struggles with is the idea of anxiety. So postpartum anxiety is actually not well defined specifically. Depression is. But so this exists pre-pregnancy, but either at a subclinical level or, again, the idea of when we pathologize something, it really turns into because there's a shift in functioning. So anything that's labeled as a disorder, by definition, is going to be because there's a shift in functioning. So anxiety would look the same as there's anxiety without the baby or without the postpartum period. It just, kind of changes to most of the anxiety is about the baby or the change in your lifestyle.
Okay.
Task management gets more difficult to do because you feel like you need to do it perfectly. So it's just the idea of anxiety that reaches the level of decreasing your ability to function in the postpartum period, which we generally think of about, just after delivery to about 3 to 6 months later. The depression is a little more well-defined. So it's basically you meet the diagnostic criteria for major depressive disorder in that time frame of the postpartum period. So specifically, you have kind of like those physical symptoms that come from, a defined depressive episode. So decreased energy, lack of motivation, you have trouble sleeping, you have a hard time getting out of bed in the morning, you feel like you just don't want to go on with your day. Everything seems so hard to do, even if it's typical tasks that you could get done on a, average day in the past. So, and again, that comes in episodes. So this episode in the postpartum period is what we call the postpartum depression.
So, I mean, what are some of the big misconceptions when it comes to postpartum depression or anxiety?
I think the biggest struggle is the expectation that society and maybe family or the repeated messages that we've gotten over time, and that we have to do this all by ourselves, that we're only a good mom if we don't ask for help, or just the guilt that comes with being perfect at being a mom, which is not a thing. So I think that's the biggest trouble, is that, you know, asking for help is really hard. Asking for help when you're actually impaired is even harder, and then that kind of creates this perpetual cycle of even more trouble, you know, self-doubt. I can't do this, I'm not a good mom, and it just brings you more and more down.
How common is it for a mom to experience this?
So actually it's quite common. In the average population, not as common, but in anybody who's experienced depression and anxiety, postpartum depression specifically is actually the most common postpartum complication across the board.
Oh, wow.
So those numbers can look anywhere from like 15 to 25% of people who have ever experienced depression or anxiety could have a postpartum depressive episode. And every pregnancy is different. So some might have an episode in you know, the postpartum period for one baby and not for the other baby. So it's quite prevalent.
And that is one of my questions of, you know, are there certain risk factors? I know, and I mentioned this to you when we were talking before, that personally I've dealt with anxiety to some extent or another my entire life. I remember my very first panic attack was when I was a very young child, watching Casper the Friendly Ghost in movie theaters. That's a whole nother story. But over the years, I've learned how to manage it, but I was terrified because I know one of my big triggers is when I'm exhausted, is very often will trigger an anxiety attack for me. So I knew, okay, I'm gonna have a baby, I'm gonna be exhausted all the time. I was fortunate in that I had a very good support system, so I was able to work through things, and I didn't experience anything outside of the average. But what are the risk factors for someone to experience kind of more severe cases?
Yeah. So the number one predictor of having postpartum depression is depression in pregnancy. So that's a huge risk factor. And sorting that out looks a little bit different too, because, you know, sometimes with the hormonal involvement or potentially having a prior episode of depression that either was, you know, what we call subclinical or not as bad. You know, sometimes people just have this idea with the stigma and everything involved, we're just going to push through. So, you know, depression in pregnancy is a big risk factor. History of depression is a big risk factor. Trauma is a risk factor. Anxiety is a risk factor, you know, history of anxiety. And then some of those other things, like your level of support, you know, how much sleep you're getting, how impactful the, you know, labor and delivery is, whether that was a positive or negative experience. And that's all based on perception typically. So that plays a big role. You know, whether the baby's well when he or she is born. So there's a lot of factors involved.
So at what point, what's kind of the big red flag of when you might need to seek some additional help? When does this go, you know, when does what you're feeling go beyond kind of the average hormonal swings that you're experiencing?
I feel like the easiest way to answer that question is kind of the idea, again, when you look at the functioning, everything about having a new human introduced to your life is overwhelming. But when it gets to the point where it's more than just fatigue, you know, you've been up taking care of the baby, or, you know, breastfeeding, pumping, feeding, whatever that looks like, and then you go back to sleep, and then you wake up and keep doing it through the night, and then if you wake up and you say, I can't get out of the bed, I don't want to get out of the bed, then you really should start thinking about, is this just tired because I didn't sleep? Or, you know, do I not have any motivation? Can I not get up and take care of this baby? Is this the point where I should be asking for help to, you know, do normal day-to-day tasks? And not so much like the housekeeping and everything that, you know, women feel so pressured to have clean houses and laundry and dishes and all this stuff done, but quite frankly, I think that's unreasonable expectations with a new baby. But, you know, we can't even manage normal taking care of the baby stuff.
Gotcha. And who is that pathway to ask for help? I mean, where do you start with that? Do you call your OBGYN? Do you call your primary care doctor? What would be your suggestion for if I'm looking to get help, where do I start? Because even that can seem like such an overwhelming task.
Yes, absolutely, absolutely. And you know, sometimes it is hard to ask for help because of this idea of the pressure of being the good mom and taking care of your baby. and the stigma of what happens if I say that I'm depressed. Is somebody going to think that I don't love my baby, or I'm not going to take good care of my baby? But again, a well mom is the best case scenario for a well baby, right? But so I often say the first place to ask is the one you trust most out of your either OBGYN or your baby's pediatrician. And so, you know, they can sort of filter through what this is, what that looks like. Obviously, your OBGYN could potentially start with, you know, some simple medication management to lift the mood. And if it goes beyond that, then referring to somebody like me to manage, you know, more complex issues.
Now is the time for new beginnings, for holding each other's hands, for encouraging each other, and for working together. At Woman's, our mission is to improve the health of all women and infants. So today, we're focused on new ways to care for you and keep you safe. Because seeing you healthy and strong is important to us.
So I want to go back to the idea of mom guilt and all the pressure that society puts on women in general, but particularly moms, and then the pressure, like you said, that we put on ourselves of the baby, the house has got to be clean, I still have to get back to our normal routine, the baby's got to be perfect, I've got to take all the pictures and everything's got to look great on social media. And I will never forget one of the conversations I had with one of my friends who she was talking about, you know, struggling bonding with her baby. And she said, you know, it took me like a couple of weeks before I felt truly bonded. And I remember saying, I don't think that's abnormal though. And she goes, well, not if you look on Facebook though. And I was like, but you're looking, you know, Facebook's kind of not always the best representation of what we're supposed to be doing. So is mom guilt is something that everyone, I think, experiences on any level, whether you're dealing with the mental health issues or not.
Absolutely, absolutely. And again, society kind of sets the bar of what that should look like, which is not realistic. But the idea of, you know, you said social media, the whole point of social media is it's a positive reward system. So why put anything on social media that's going to give you anything but positive rewards? That's why it all looks good. But is it realistic? Probably not. Is it fake sometimes? Absolutely. So there's always the good with the bad, you know, but in even the idea of looking at some friends, you know, sometimes we perceive, well, she's got it all together, I don't know how she does it. But nobody really does. And or they have people that they're going to that kind of help them with the situation. So it's not it doesn't have to be an independent process. It doesn't have to be that you're doing the mom thing by yourself. It should be, you know, it takes a village is truly kind of how we were created. And so the bad does come with the good, and the fact that you can't sleep overnight does make a huge impact. And, you know, babies don't latch, or they cry, or they have upset stomachs, or you can't figure out what it is. And then all of a sudden, when you feel like you did figure it out, we're just in a phase and we've switched 2 days later to a totally different sleep pattern. It's like, you know, always with the unpredictability, and it's really challenging to kind of get your feet settled and have a routine to feel good about that. And meanwhile, we all have opinions, and so many people feel obligated for some reason to share them, which is often not helpful. Because what works for one mom may not work for another mom. What works for one baby may not work for another baby. So I often say if it's well-meaning and well-intended, then sure, I can appreciate the sharing of those opinions. But even if you're one of those people giving the opinions, really considering, is it solicited or unsolicited, and is it helpful or not helpful? So if we're past the point of this being helpful, meaning something happened, and then you express your opinion about something that's already happened, we can't change it, let's not share that. It's not helpful.
Yeah, sometimes it's okay just to not, I said not share things.
Right.
Well, what do you think is the biggest, I guess, what's the biggest lie that we tell ourselves that, you know, that we say we have to do, or we've got to, that contributes to the mom guilt?
A couple of things. One, that we can do it all by ourselves. I think that's one of the biggest things. Two, that we're going to get it right all the time. complete misconception. We're never going to get it right all the time. I do a fair amount of parent training, and I feel like I know all the right things to do when it comes to parenting, and I still screw it up all the time. My kids are not perfect, nor do I expect them to ever be. But kind of extending on beyond that, this idea that sometimes we expect it, and generally this is more with the idea of kids as they grow and learn and develop their own personalities. Sometimes we really have this strong hold in our kids being a reflection of who we are. And I get a little bit kind of taken aback by how much people perceive their kids to be, unintentionally, but kind of this idea of they're show ponies. If they look good and they're doing all the right things, then that makes me look good. But kids are unpredictable, and they do things that might reflect poorly or not as great on moms. And that's not, it doesn't mean you're a bad mom. It doesn't
They're
mean
going to break down sometimes in the middle of the grocery store.
Yes, absolutely. And so, think about the woman that you saw in the grocery store and how she reacted to the kid having the tantrum. Is she so freaked out because everybody's looking at her, or is she kind of just taking it in stride, And really, it doesn't, you can't predict and you can't control children's behaviors, babies' behaviors. So you just have to sort of learn to adapt and understand that they are doing whatever it is that they feel like they need in that moment to get their needs met. And so just try to interpret what the kid's doing, what they need.
Sounds like as a society, we could probably help moms by, sounds like being a little less judgmental.
Yes, absolutely. Absolutely. I think it just makes such a huge impact.
And that plays into it takes a village. You said something before that I think is just so, we're not meant to do this alone.
No, we were not built that way. We absolutely were not. We're not built with the idea in mind of doing anything independently. We are emotional, well-connected beings. It's how we are built. It's how we live our life. And we've just created this society that really just makes it seem like that's not the case. Being strong and powerful does take a lot of people to get there. Supports in place, whether that's a strong and powerful and confident mom, or business person, or whatever it is.
Yeah, absolutely. So one thing that I also wanted to talk about, and you touched on it briefly, you mentioned, again, if you've experienced positive birthing, or if someone is a victim of perhaps trauma or abuse in their life, that is putting them into a situation where they might also be more at risk for experiencing mental health issues postpartum.
Yes.
So what's the importance of? Let's talk about that a little bit more. What do people need to know about that?
So trauma does play a big role in the whole idea of, pregnancy, postpartum, bonding with the baby, and trust. So the idea of trust, going back to, asking people for help, or this perception that nobody can take care of my baby the way that I can, and realistically, that's true because you're their mom, but at the same time, it doesn't mean that your baby's not going to be well taken care of. It just might look different. So I think that plays a big role in whether or not they're able to or can trust other people in asking for help. But, there's a lot of other impacts as well. This idea of what the trauma looked like and how that might play a role in their whole pregnancy and postpartum experience. There's a lot of intimacy involved with, your OBGYN and people in the room and your supports and all of that, just in the process of your body changing and creating this life, and then delivery, and then the idea of breastfeeding and what that looks like, and are you comfortable with the touch that might come with breastfeeding it, and is your, there's this like mind-body connection. Is your body going to let you, is your mind going to let your body actually create the milk to feed your baby, or is it going to be uncomfortable?
Or is that something that could contribute to stress and additional stressors and contribute to depression?
Right, absolutely, absolutely.
And that is so true. I think a lot of I think a lot of new moms probably don't realize how much you're touched. That's if you're not a touching person,
Yes.
you constantly have this little human attached to your body in some form or fashion, whether you're breastfeeding or not, but particularly if you're breastfeeding. I remember there have been several moments that, after having the baby all day and breastfeeding, which I loved to do, but then that would also be, my husband would come over. I'm like, just leave, don't touch me. I've been touched all day.
Yes.
I need a minute just to breathe here. It gets a little overwhelming.
It absolutely does. I think too in the clinical world sometimes we forget because we're just so exposed to it that it's just natural to us. The nurse might come in and just grab on to help the baby latch, and it's like, whoa, like that's.
And I can imagine if you're someone who has experienced trauma or abuse in your past, that could be very triggering.
Absolutely, absolutely. So it definitely is something that we all need to kind of take a step back, but to support moms in this ability to ask for what they need and set boundaries when appropriate if they become uncomfortable in those situations, because we don't want it to turn into a negative experience and really kind of impact what the next steps look like and the postpartum period looks like. And if the delivery was traumatic because there was too much touch and it wound up being triggering, that does and can impact the bonding with the baby and the experience and overall ability to move forward. Because once you open that can of worms, sometimes the symptoms don't really subside when it comes to trauma symptoms. So you got to be real careful with that.
One other thing we want to talk about is, so let's talk about the pandemic effect. Things have kind of slowed down a little bit, but we're still dealing with some aspects of that. But during this time, and you recently had a baby I think we both had a baby during the pandemic, and I think we can probably sum that up as it being a very lonely time.
Absolutely.
How does that affect the mental health of a mom?
So the idea of it being a lonely time, nationwide, I think a lot of the appointments were you could only go by yourself, so no supports. Labor and delivery might have been no supports. You could only go by yourself. The potential risk for having your baby taken away if you were exposed or tested positive, but we were concerned about symptoms.
I was terrified about that.
It's awful and it's scary, and God forbid the pregnancy is complicated and there are potential things going on that you want your husband there, your support there in that appointment when you have to get some possibly bad news. It is really terrifying and lonely. And also the idea that having somebody there with you to celebrate and the excitement of it is also as impactful to not have that person there too. And it's helpful to mention too, like the poor dads who didn't get to go, the ones that were there for the previous pregnancy or baby or wanted to be because it was their first baby, and that's tough on them as well. And their the impact on the relationship and their ability to bond with the baby.
Yeah, absolutely. So if someone has experienced that kind of loneliness, I guess what's your advice? How do you stay connected?
So again, I think asking for supports. I think we're moving kind of past that at this point in terms of not having so much limitations on who can be present and who can go to appointments and that kind of stuff. And maybe in the clinical world, having a little more flexibility with the idea in mind that it does, having a baby is a positive experience, generally speaking. But when there are times and places where we can allow for a support person to come along or the dad to come along, being a little more flexible in that, because while yes, you might increase the risk of some exposure or COVID or any other virus, but the mental health impact is important to take into effect as well. And in the clinical world, we talk about this idea of risk versus benefit all the time. So it's got to be a consideration. It's got to be a consideration.
Full holistic approach.
Absolutely.
So talk to me about treatment. So I know with postpartum depression, anxiety, just like any kind of major depressive disorder, there's kind of a range of severity and a range of different treatment options. What are the treatment options here?
So the treatment options look very similar to, treating anxiety and depression outside of the postpartum or peripartum world. They've done, actually, the medications that we use for mental health, specifically for anxiety and depression and trauma, are even more well studied in pregnancy than any medication that we've ever studied in pregnancy across the board. So we have more data because of the importance of the mental health and the mom's prognosis and being able to care for that baby. So yes, the studies are rampant. We know what happens and what doesn't. We have had millions of women that we've studied, and it's documented, it's put on paper. So we know the risk versus benefit, we know the safety of it, we know the importance of it. And barring very little consideration, that might be case specific, most people should be treated versus not on these medications, because we know that the safety is, really good, and that treating the disorder is way more helpful than any potential risk that could come from specifically those medicines. Realistically speaking, though, a lot of clinicians might be uncomfortable with that because they don't have the data, haven't learned the data, don't have the access to the data, and there's some liability involved and a lot of emotions involved in this idea of exposure. But again, kind of thinking about exposure versus not exposure to a medicine might sound scary, but exposure versus not exposure to symptoms is even scarier when you consider that symptoms can be toxic in the womb. Symptoms alone and all the hormone shifts and the changes and the neurobiological kind of impact of that is also unhealthy for the baby.
Talking about postpartum depression specifically, in the last few years there's been a new kind of treatment that's and I forget what the medication name is, but I know it's an inpatient treatment.
Yes.
I know a friend of mine that had experienced very, very severe depression and was hospitalized and went through this treatment, and it was very helpful for her. I remember reading about it and thinking, what a wonderful resource that's out there.
Yes.
But that's only for certain cases, though.
So it's for certain cases. It's a little bit complicated. It is newer, and it is the complicated piece is that a couple of things. One, that you have to be inpatient to get the treatment because it's infusions. So those infusions have to be monitored. The pay for it obviously is a big thing because it is quite expensive, as you can imagine. And I think there's limitations on whether or not insurance would cover it. So it probably would be an out-of-pocket expense. And then because it's inpatient, you have to consider that the mom won't be with the baby. You have to be separated, right? And so the impact that might take. And with severe cases, obviously that's better than, alternatives or not good enough outpatient medications. But the other part is that, the reason why it has to be inpatient is that it does have some pretty significant potential risk factors or side effects that you have to, weigh the risk factors and know, is this a good candidate? Is this not? There are some centers here in our area that have that, but it's pretty limited. We don't specifically have it here at Women's Hospital. Though we have tossed around the idea of having that, creating that program here.
But there is just a wide range of options that are available that can be tailored to your case.
Yes, absolutely. The idea of that would be for kind of quicker improvement than something, for somebody that might potentially wind up with symptoms that rise to the level of needing, psychiatric hospitalization or something like that. But generally speaking, most of the women who experience this do well with just outpatient medications that they take daily.
So, Dr. Parden, I think that's kind of a lot of the topics that I hope to address. Is there anything else that you want moms out there to know? I mean, any kind of final message? I think the fact that we're not meant to do this alone is so important, and I think it's also kind of important to say it's okay if you're experiencing this. It's okay if parts of your life kind of have to take a back seat. If it's okay to put down breastfeeding if that's contributing to your stress. What are other things that you want moms to know?
I think the biggest thing is really, and I tell all of my patients this, mom or not, the idea that you have to take responsibility for yourself. You have to take care of yourself, and in doing that, you can take better care of your baby, but ultimately, you are truly only responsible for yourself and your baby. So again, kind of letting the judgment that will come, because this is just, it's not great, but it's what we do to each other, and our society does to us. And the grandparents that have opinions, or the friends that have opinions, or the sisters that have opinions,
or the random person in the checkout line at the grocery store has an opinion.
the complete stranger that has opinion. Everybody has opinions, but it's not their life. It's not their choice, it's not their baby. So and the point of that is to say, not letting the stigma of what their opinion is impact what you choose might be best for you and your baby and your family. Because it is your life, and you have to figure out what works best and what fits best. It's not a one-size-fits-all. And just because somebody might think that you should be breastfeeding, or you should never take medications while you're breastfeeding, or while you're pregnant, they don't get to decide. Those people don't get to decide. So take your life back, live your life for you, and take responsibility for you and your baby. And ultimately, that might take a lot of therapy to get there, realistically. But that's how you get to feel better. That's how you get to not be, this struggling, overwhelmed, symptomatic mom, and can live your own life. Enjoy your life. Enjoy your baby.
All right, that's very empowering to hear.
Yes.
Take back your life.
Yes.
I like that a lot.
Yes. So many people function on what everybody else needs, not what they need.
All right, I think that's a good place to end there. Dr. Amber Parden, thank you so much for your time.
Thanks for having me.
Thank you for watching. Make sure to subscribe to WAFB's YouTube channel for more great podcasts.